अरे उससे हो गई बात माथुर से।
Namaste everyone. My name is Medha, Assistant Professor, Department of Pharmacology at Amar Shahid Baba Ajit Singh Jujar Singh Memorial. It's an honor to be your host for today's online lecture series. I'll be guiding you all throughout the session and make most of our time together. First of all, let me introduce you all to our college. Amar Shahid Baba Ajit Singh Jujar Singh Memorial College of Pharmacy, Bela, Ropar, Punjab is one of the premier institutes of the northern region, established in 1993 by a non-profitable society in a sacred memory of Sahibzadas Ajit Singh Ji and Jujar Singh Ji, the variant sons of Guru Gobind Singh Ji, who sacrificed their lives for righteousness at the young age. The Institute has made remarkable progress over the last 3 decades and offer various programs including diploma in pharmacy, bachelor's in pharmacy, master's in pharmacy, in which pharmaceutics, pharmacology, and pharmaceutical chemistry departments are there, MSc pharmaceutical chemistry, MSc microbiology, and bachelor's in medical lab sciences. An autonomous institute, College of Pharmacy Bela, is affiliated with IKG-PTU Jalandhar and is also a recognized PhD research center in pharmaceutical sciences. The college is accredited by NBA and recognized under UGC 2F and ranked 57th in NIRF 2024 and placed in platinum category in AICTE Industry Linked Survey 2018 and 19. With excellent infrastructure, modern laboratories, and dedicated faculty team, the institute ensures high quality education and hands-on industry exposure. It's envisioned becoming a world-class institute in pharmaceutical education and research, committed to producing skilled professionals ready to meet the evolving demands of healthcare and pharmaceutical sectors. So let's get started and make most of the today's session. Welcome everyone to today's online session series. We are incredibly happy to introduce today's special guest, Dr. Anoop Kumar, Assistant Professor of Pharmacology at Delhi Institute of Pharmaceutical Education and Research, DPSRU, New Delhi. Dr. Kumar has spent over 12 years working in education, research, and industry and is a well known expert in his area. His main focus is on pharmacovigilance, drug safety, network pharmacology, and antimicrobial drug discovery. Dr. Kumar has written over hundreds of research papers and book chapters and published them with Springer CBS publishers with over 2,900 citations, and he has an H index of 27. He has successfully handled DST, SCRB, and ICMR funded projects and was recognized among the world top 2% scientists by Stanford University. Dr. Kumar is also an active member of APTI and IPS and contributes to various academic and editorial boards. We are truly honored to invite him with us and learn from his expertise on the topic meta analysis, principles, and processes. I would like Dr. Anoop Kumar, please start with your session.
Yeah, very good morning, everyone. And thank you, Mega, for kind introductions.
Thank you,
And
sir.
first of all, I would like to thank Director of the Bela College of Pharmacy, Salesh sir, Ajay Kuswaha sir, Rahul sir, and all other faculty members, Suman Lata ma'am, and others faculty members for giving me the opportunity to be part of this lecture series, online lecture series. And I am going to talk on meta-analysis, particularly what are its principle and what are the processes. So for next 1 hours, I will try to give you an overview about what actually the meta-analysis. If anyone of you plan to do the meta-analysis, so how you can do it as per standard protocols where you can do the registrations or all these kind of things I am going to cover. And little bit part, what kind of softwares which are available by which you can do the analysis. So starting from very basics, what actually the meta-analysis is and how it differs from systematic review. So before going into details, these views presented here are my personal view, not of view of my organization, just a disclaimer. So as I said, what I am going to cover, starting from the basic introductions, then how to develop a protocol for the meta-analysis. And of course, when you develop a protocol, so you have to do the registrations like you are doing for a so if you are planning for a animal experimentation studies, so you have to put your protocols to the animal ethics committees and you got the registration certificate. Like that, if you planning to do a clinical trials, you have to submit your protocol to human ethics committee. So similarly, when you are planning to do a meta-analysis or systematic literature review, it's always better to, if you register your protocols with international registers like Prospero. So what is the registration process when you will go for a registrations that I am going to cover, and how to make the search strategies according to your research questions into the PICO formats, and then how to do the quality assessments and how to extract the data, how to prepare a data extraction sheet and what kind of data you have to put it, and then how to analyze that data. And little bit part I am going to talk on grade analysis. Now after systematic literature review and meta-analysis, you have to do the grade analysis, you have to do the grading of evidence as well, so that will strengthen your SLR or meta-analysis. And what are the various AI based tools which are available which will help you to expedite the process, followed by the conclusion. So before starting with SLR and meta-analysis, if you want to become a experts in SLR and meta-analysis, so what skills are required? So what is required to become a experts in SLR and meta-analysis or grade analysis? So, so of course, I always say to the students, first is there is no alternative for the basic knowledge. Everyone of you should have a basic knowledge about your subject, understandings of research designs and data. If you are not able to understand the research design, or you are not able to understand how many types of data and what is continuous data, what is dichotomous data, what are the measure for center tendency, what are the dispersion of data, what are parametric test, non-parametric test, and so on. So so you can't become a experts in SLR and meta-analysis. So research designs, understanding of research designs are also important, if you are, because you are going to extract the data from the research studies, particularly if you are taking the data of the clinical trial. So you should have a good knowledge about the clinical trial terminology like blinding. You have to clear about blinding, randomizations, concealment, your parallel design, adaptive designs, all designs of trials, phases of trials, types of trials. So all these basic knowledge you should have. That is the one thing. Another thing, you should have a knowledge about the biostatistics as well, because it's a analysis. So you have to do the analysis of the data. So basic knowledge about the biostatistics you should have. If you not able to understand between standard deviation and standard error of mean, so how you will become a good SLR and meta-analysis experts, right? So these basic knowledge is required. Another thing is, because you have to search the studies in various databases, so you have to be familiar with databases, you have to familiar with the literatures, and then you have to extract the data. So that is another things which is required. And of course technical skill, in technical skill you should have a understandings about so R package. I always recommend R package to the students for the SLR meta analysis. The reason why I am recommending that, because it's a freely available. there is you have not to pay anything. Yeah, there is no subscription, nothing. Yeah, it's freely available. Every students can install in your laptop, and you can use the R package not only for the meta analysis, but you can use it for analysis of various kinds of data. You can apply the biostatistics, you can do the disproportionality analysis, many analysis, you can do the gene wide association studies, and so on. So our package, I always means say to the students, uh, we use the R package, try to use it. It's not very complex. It's little bit command based because we all are comfortable with Windows. So it will take little bit time, but once you will comfortable with the R, you can do lot of analysis. As I said, not only the meta analysis, but you can do other analysis as well. Other analysis of your experimental data as well, which you are generating by the animal studies or any other tools. You can do the analysis, and in your CVs, when you are putting in the technical skill that you knows R package, so it will give you the upper edge in the interviews as well. But again, if you go for an interview, you have all these skills and you are going for an interview for the SLR or meta analysis, or evidence based research, but still you have not selected. So what is the reason? The question is, you have all these skills, whatever I told you, and these are the skills which are required to become a experts in SLR and meta analysis. You have given the interview, but still you have not selected. Then you will ask to your teacher, you told me these skills are required and I am very good in all these skills. I have a basic knowledge about research design. I have a good knowledge about biostatistics. I have used various databases for the literature. I know how to use the R or other softwares, but still I have not selected. So what could be the reason behind it? Why candidate has not selected? The reason is, talent is not enough. You need discipline, dedications, characters. And you all know more people have failed not for the lack of talent, but lack of character. So, your approach towards life, or approach towards how to handle the problems. You have all the skills, but if you are not able to handle the problems or small problems, so the companies will not going to hire you. They will see your character as well. They will see whether how much dedicated you are, how much disciplined you are. If you are not disciplined, you have all the skills, but still you will not get the job. So all these things are important, just a basic background. But coming to the topic, as I said, topic is meta analysis. So if you see this word carefully, there is a analysis. So to do the analysis, what is required? Generally speaking, meta analysis, if you see this word carefully, there is a analysis word is there. So for the analysis, you need the data. Without data, what analysis you can do? So of course you need a data, and then you can do the analysis of that data. So from where you will get the data? In meta analysis, experts are not going to conduct the experiments in the lab. They are not going to conduct the clinical trials. What they are doing is they are extracting the data which is already published in the literatures, putting in the data extraction sheet, and then they are analyzing it. So that is the meta-analysis. So meta-analysis could provide clarity among published studies, right? So it's a quantitative approach. This word is important, quantitative. It's a quantitative because you are going to do the analysis, and to do the analysis you need a data. So it's a quantitative, not qualitative. It's a quantitative approach. For what? For systematically combining results of previous research, right? As I said, meta-analysis experts are not going to do the experiments in the lab. What they are going to do? They are going to extract the data which is already published in the literature and going to analyze that. And by analyzing that data, they are making the conclusion out of it. That is your meta-analysis. So provide pooled estimate when you are doing the analysis. It provides a pooled estimate of the effect size of individual studies and will resolve the conflict between studies. So whenever there is a conflict in the literatures, so meta-analysis is the one of the best tool which provide the clarity among the published studies. In some simpler way, I just added two pictures. Means what actually the process of meta-analysis means, how to do the analysis. That is the second part. But before doing the analysis to get a data is the major task. Because reason is, if you just type in a PubMed or any database, any terms, you will find there is a huge literature is there. Lot of literature is there. So you have to be refined your research questions, what you are looking for in the literature. That should be very much, yeah, that thing should be very clear in your mind before starting meta-analysis or SLR. Right? It's just like a ocean, right? The literature is so much. If you just check the databases, literature on particular, if you are going to check the literature on hypertension, just add the word hypertension. You will get lot of research articles related to hypertensions, right? So it's, as I said, it's just like a ocean. So what you are doing, you are putting the net, right? For example, for catching the fishes, right? आपने नेट फेंका. Net is what? Net is your search strategies which you are making, that I want that particular literature only, not the whole literature, right? So you have defined your inclusion and exclusion criteria. So it should be very clear, right? You can't, as I said, generalized terms. You said I will do meta-analysis on hypertensions. What hypertensions? What meta-analysis you are going to do on hypertensions? Right? You have to define which type of hypertensions, which type of patients, which type of interventions, what is your outcome. So you have to define your inclusion and exclusion criteria. So it's just like a net. ओशियन में बहुत सारी फिशेज हैं, आपने नेट फेंका फिशेज को पकड़ने के लिए. सो ओशियन इज योर लिटरेचर, राइट? बहुत सारा लिटरेचर अवेलेबल है. आपने अपना डिफाइन किया कि मुझे इतने नेट में ये फिशेज चाहिए. सो इट कैच द फिशेज. कैच करने के बाद आप क्या करते हो? फिशेस आपकी निकली, उसके बाद आप चेक करते हो कि कितनी गुड क्वालिटी की हैं, कितनी पुअर क्वालिटी की हैं, कितनी मीन्स नॉर्मल है, राइट? तो दैट इज वी आर डूइंग आफ्टर catching the literature on relevant topic, then we are segregating the studies. That is we call quality assessment. तो आप देखते हो आप कितनी सारी फिशेज आ गई. इन सेकंड पिक्चर यू कैन सी दैट ये फॉर एग्जांपल योर लिटरेचर कम्स आउट. So now you have to do the quality assessment of the literature. Which one is good? How many studies are good? How many studies are very good? How many studies are excellent? How many studies are poor? So that assessments we are doing. And for that assessment, what is required? How you will say that out of these 1000 fishes, which one is of excellent quality? You have to look some parameters. आप उस फिश को चेक करोगे, फिश को चेक करोगे कि यार ये बढ़िया लग रही है, ये शाइनिंग कर रही है, इसमें मुझे कोई वो प्रॉब्लम नहीं लग रही है. आपने अच्छे से चेक कर ली एंड पुट इन दैट कैटेगरी, इट्स ऑफ गुड क्वालिटी. So similarly, when you are getting a literature, after that you are doing the quality assessment of the literature. And to do the quality assessment of the literature, we have a quality assessment tool. Because there should be some criteria, on basis of that you will say that these are of excellent quality, these are of good quality, these are of these qualities. So similarly, we have a scales, that is we call quality assessment scales. So different scales. There is a questionnaires. You will open the articles. There is a questions. Is rationale is defined? Is objective is clearly defined? Is blinding is done? Is randomization is done or not? So accordingly, you will do the scoring of the articles, and then you will do the total. And according based on that score, your article can fall under good quality, good excellent qualities, or poor qualities, right? So to do the meta analysis, which type of literature you want? Do you want poor quality literature? No, right? So you want good quality literature. That's why when you do the analysis of the good quality or excellent quality literatures, whatever the conclusion you will draw on, it will be acceptable by large community. Because meta-analysis results will help the doctors as well, practitioner as well, to make a better clinical decision out of it. And if you have considered poor quality studies, then question will arise. Okay, whatever conclusion, whatever analysis you have done, but you have analyzed 10 studies, for example, out of 10 studies, 5 are of not good quality, these are of poor quality. So they will arise the questions on your meta-analysis. You have considered the poor quality studies, so how I will believe on your analysis? So that's why you have to do the quality assessment after this. So there is a two terms, because before doing the meta-analysis, you have to perform the SLR, systematic literature review, right? So sometimes students are confused between systematic literature review and narrative review. There is scoping reviews as well. So, sir, you just see the word carefully, systematic literature review. So there is a systematic examinations of the literature. That is systematic literature review. Narrative review, you are doing randomly. You have, for example, you are writing any review articles on XYZ topic. You have just search in the Google Scholar or PubMed or any others, and you collected 10 or 20 articles, recent articles, and you have written review based on that. That is your narrative review. You have not used any systematic approach to analyze the literature. When you are using a systematic approach to analyze the literature, that we call SLR, systematic literature review. So to do the systematic literature review, that means you have to follow some systematic steps. You have to follow some standardized steps to do the literature. That is a systematic literature review. And after systematic literature review, when you have done the systematic literature review in a systematic way, then you can think of whether I can do the meta-analysis or not. Sometime I feel that many students comes to me and they said, sir, I want to do the meta-analysis on this XYZ topic. And when we started the work, because before doing the meta-analysis, you have to do the systematic literature review. When we have done systematic literature review, then we found that because the data is not a uniform way, so we can't go for a meta-analysis. We can restrict ourselves up to SLR, systematic literature review. Systematic literature review, if you are doing in a standard way, you can publish it in a high impact journal as well. But depending upon what kind of data is available in the literature, available in the research articles, you have to decide whether you can go for a meta-analysis or not. But sir, students will ask you, sir, I want to do the meta-analysis, but you stopped me up to systematic literature review. But मुझे तो मेटा एनालिसिस करना था, और मैंने जब आपसे पहले बात की थी तो मैंने बोला सर मुझे मेटा एनालिसिस करना है इस टॉपिक पे, पर अब आप मुझे बोल रहे हो कि सर कि सिस्टमेटिक लिटरेचर रिव्यू तक ही इसको क्लोज कर दो. So, what it means, every systematic literature review may or may not be converted into meta-analysis. It depends. और वो अगर आपका if it's a new topic, new research questions, so you don't know whether you can go for a meta-analysis or not before doing the systematic literature review. After completion of systematic literature review, you can decide whether I can go for a meta-analysis or not, right? So that's why bigger circle is representing systematic review, smaller circle is representing meta-analysis. And as I said, every meta-analysis should have the systematic literature review. Because as I said before, this one, first you need the data. For analysis, you need the data. And data from where you will get? You will get the published data. And where the data is published? Data is published in the literature, in the databases. So first you have to be analyze or extract that data in a systematic way. That is a systematic literature review. So every meta-analysis have systematic literature review. But if you say that, if I give the statement, systematic literature, every systematic literature review may or may not be converted into meta-analysis. It may or may not be, depending upon the data, what you are getting. So that's why, for example, there is a 1000 systematic review. Maybe out of 1000, only 100 are converted into meta-analysis, right? But as I said, you can publish. Don't worry if you are not able to do the meta-analysis. जबरदस्ती करने की कोई जरूरत नहीं है कि मुझे जबरदस्ती मेटा एनालिसिस करनी ही है. नो, you can still publish SLR in a high impact journals, right? If you have done it in a systematic way. So if you see the health research pyramid categories, you will find that the lowest priority is given to the animal and laboratory studies. With respect to if you are going for a clinical practice guidelines or evidence-based guidelines for particular treatment, then on the basis of animal or laboratory study, you can't make it treatment guidelines, right? So that's why it's at the lower side. Then there is a case report. Case report is the report of single patients, case series, more than one patients. Then there is a narrative review, expert opinion, editorials. Then there is a cross-sectional studies. Then there is a case control and cohort studies that are well-known observational studies. Then upper is your RCT, randomized control trial. And above the RCT, there is a meta-analysis and systematic review. So meta-analysis and systematic review are playing a significant role in the development of clinical practice guidelines. That's why if you see the Department of Health Research, ICMR, is providing the funding to the researcher to do the meta-analysis and systematic literature review for development of particular guidelines. So recently our lab got the funding from the ICMR to do the SLR and meta-analysis for antibiotic guidelines in for India, right? So we have just completed that research systematic literature review. That results will be used for the development of antibiotic guidelines by the ICMR. So various researchers across the countries got the funding and they got the research questions from the ICMR, and we have done it and we have submitted. So what I mean to say that for these kind of research also you can get the funding. It's not like that you are getting the funding only for the experimental work. You can, if you are doing it in a proper way, you can get the funding to do the systematic literature review and meta-analysis as well. So now question is when it is required. For example, some one student comes to me and student is asking, I want to check antihypertensive effect of beta blockers, beta 1 blockers like atenolol, ismolol, or any beta blockers. So now question is it a good topic to do the SLR and meta-analysis, right? For example, someone comes calcium channel blocker like nifedipine, amlodipine, verapamil, or diltiazem, and they are student is saying, I want to see the anti-hypertensive effect of calcium channel blocker. Is it a good topic for SLR meta-analysis? Can anyone unmute and answer? If someone is planning to do a meta-analysis on topic use of calcium channel blockers in the treatment of hypertension. No, it's not a good topic. Why it's not a good topic? The reason is it's already known. It's already known that calcium channel blockers or vasodilators are being used in the management of hypertension. Right? Beta blockers are used for the cardiovascular disorders. So why you want to do that? It's already established and there is no conflict. If there is a conflict, as I said, whenever there is a conflict, for example, in literature, one set of literatures is concluding that calcium channel blockers are not useful for the hypertensions. Another set of literature is concluding that calcium channel blockers are useful. Another literature is saying there is no significant effect. So there is a controversy in the literature. So when there is a controversies, when there is a confusions, these types of the topics are good to do the meta-analysis, right? But if you want to do use of aspirin, how aspirin reduce the death of the myocardial infarcted patients, so it's not a good topic. But in COVID time, we have done one meta-analysis where we checked the effect of aspirin in the death of COVID-19 patients. So it's a good topic because you don't know in the COVID-19 patients whether aspirin can be useful to reduce the death of COVID-19 patients or not. It's a confusion, right? So whenever there is a confusions, you pick such kind of topic and start working on SLR and meta-analysis. So that you have to be define your research questions very carefully. Otherwise, you will get a problems when you are submitting it for the any journals or you are presenting the work anywhere else. They will ask you the questions why you have done it. It's already clear in the literatures. All the clinical trials have reported there is a significant effect of this treatment. There is no confusion, so why you have done that, right? So whenever there is a confusion, so try to pick up such kind of topic to resolve the confusions among the physicians, because physicians are also confused. If you ask them, they will say we are not sure about whether this treatment will work or not. whether this treatment is safe or not. We are not sure about it because we don't have the data regarding that. So that's why first step is you have to be define your topic. Take your time to define your topic. Don't be in hurry कि आपने आज डिसाइड कर लिया, बस आज ही आपका टॉपिक फटाफट आपने वो कर लिया. बिकॉज सिलेक्शन ऑफ टॉपिक, डिजाइन ऑफ द टॉपिक्स और रिसर्च वर्क, any research work will take time. You have to give the time. You have to define your research questions, and you have to be define everything should be clear in your mind what you are doing, why you are doing it. Otherwise, when you are doing the screening of the literature, you will be confused. Why you will be confused? Because you are not clear about what you want to do, what is your research questions, what you want to analyze, right? So you have to be very much clear about it. And when you are clear about your topic, and of course in topic selections you have to search in the literature. For example, your topic is very good, your research question is very much defined, and when you have done the search already, for example 7 days back, someone has already published that work, right? If someone has already done just 7 days or 1 week back or 1 month back, then question will be arise on your topic, then why you are doing it. Then you have to be see how my research question are different what is already published. That is the one way. If you are searching in a literatures and you are finding that on this topic already one meta-analysis has been done, but it's published in year 2010, so you can pick up such kind of topic as well, because in 2010 the number of studies can be different because already 15 year has been passed out. So you can update that SLR and meta-analysis, right? So that you can make the rationale of the studies. So protocol development, when everything is clear, so you have to write the protocol. So first step is you have to define your topic according to your research area, then you have to write the protocol. So protocol, I think you are writing for your research work as well. Everyone knows what actually the protocol is. It's a protocol is a document which clearly describe the objective, eligibility criteria, search strategies, quality assessment methods, analysis, and representation of the result. So each and everything you have to define your protocol. What is your PICO? What is your inclusion criteria, exclusion criteria? What search strategies you are going to use to check the literatures, what quality assessment tools you are going to use to assess the quality of the studies, what methods you are going to use, right? Each and everything you have to describe in the protocol. You have to describe the plan for the minimization of bias. There are various bias which can be created during the SLR and meta-analysis. So you should have a plan how you are going to minimize these biases, like language bias. If you are considering only the studies which are published in English language only, so that could results in the language bias. Maybe there are studies which are published in Chinese or in other language, Japanese or other language. So if you are not considering, so it can arise the language bias. So you have to try to include these studies, but if it's not possible, so in limitation section of your meta-analysis, you have to mention that. How to address the heterogeneity is you have to describe if there is a heterogeneity is much more. Obviously there is a heterogeneity because you are pulling the data from the different types of studies. Studies can be different in terms of their research design, number of participants, genders, duration of treatment. There are various variables which could results in the heterogeneity. So how you are going to address that heterogeneity, that also you have to describe in the protocols. If you are getting 100% heterogeneity, so whatever the results you are showing, someone will ask you, okay, you are, meta-analysis are always criticizing for this because you are mixing the apples with the oranges, because there are different types of studies, you are mixing it together and making conclusion out of it. So if you are getting 100% heterogeneities, so you have to be see what are the reason for this heterogeneity. You have to be, if there is a outlier, you have to be remove that outlier and you have to do the analysis again. It will be called sensitivity analysis. So you have to, and if still there is a heterogeneity, you will go for the meta regression as well. So you have to define in protocol which factor could affect the result of studies. And once your protocol is ready, so what is the next step? Next step is, now you have written the protocol for your SLR and meta-analysis. Now next step is, don't forget this step, you have to go for the registration of your protocol. Sometime what happens, and in earlier we also faced the problems, you have started you have a very good research questions, you have done SLR meta-analysis in a standard way, each and everything you have done in a proper way, but you forget to register your protocol in the international registry, or you forget to register your protocol. So reviewer will ask you the questions whether your protocol is registered or not, and if you are mentioning no, so it will give you the negative marks, right? Means, because if you are doing it, you are hitting a big impact journal, so you have to be registered your protocols before starting the work. Once you completed the work, now if you want to do the registration of the protocol, it will not be done. Registration, like for examples, if you have completed your animal experimental studies before getting the approval, can you get the approval after completion of animal experimentation studies? No. How committee will approve it? So similarly, when, for example, if you have completed your SLR meta-analysis, now you are applying for the registrations for the protocol, your protocol will not be registered. So that's why I am saying, when your protocol is ready, please go for the registration. That is the next step. And still you have not started the work. Protocol you have written, how you are going to do it, but you have not started your systematic literature review or meta-analysis. So before starting it, go for the SLR registrations, and you can do it in various registers are there, international registers are there, like Prospero. Prospero is one of the well-known, and many systematic reviews or meta-analysis has been registered in the Prospero. So in Prospero, you can do the registrations. This is the screenshot of Prospero, where you just type in a Google Prospero. It will looks like this. Here you can click on join, and you can do the registrations with your login ID and passwords. And after that, this is my registration on Prospero, Anoop Kumar. And when I will click on my Prospero, that protocols will be reflected out, which are registered with my name. So if you are going for a registration, what you have to do? You have to register a review. So you have to click on register your review now. So these are the steps. So SLR is not only for the clinical studies or only for the clinical trial. If you are doing animal experimentations, your work is in preclinical area, so you can also perform the SLR, but here you have to select these options rather than these options. So there is a registered a systematic review of health research studies when your study participants are human. When your study subjects are animals, so in that case you have to select this one, and then next step will come up according to animal experimentations points, right? So you can do that one as well. They will ask you the some basic questions. Will your register record be in English? Is this a scoping review? Scoping review or mapping review or narrative review is not going to be registered by the Prospero. If it's a SLR you are going to conduct, that only registrations can be done by Prospero. So it will ask you, have you started your review? If you are clicking on yes, then next step will not happen, because if you have already started, so what is the point to do the registration of the trial? Registration of your systematic review. So you can see that in various screenshot I have added, you can add your title, you can add the anticipated or actual start date, completion date. These all dates you have to mention. All these questions and keywords, what is your, these are the protocol which we have registered during the COVID time, drug acting on rats. These studies are published in journals as well. If efficacy and safety of TMS, transcranial magnetic simulations in common CNS disorders, systematic review and meta-analysis. So like that, you will get the registration number. If you have submit your protocol to the Prospero, sometime they will email you back with their queries. And if your protocol is registered, so you will get this number like this. CRD420. This is the number which is given by the Prospero for this protocol. So this number you have to mention in the methodology sections of your SLR meta-analysis, that the protocol of this study, like in animal experimentations, you are adding in the methodology sections This study is so registered, means approved by the Animal Ethics Committee, and this is the registration number. So like that, you have to mention the protocol of this systematic review and meta-analysis is registered with Prospero with this registration number, right? Apart from Prospero, there is open science framework as well, that is the OSF. Prospero take little bit time for the registrations, whereas OSF and Impulse will take less time. But you can; these are also freely available, so you can submit your protocol to OSF or Impulse as well. So these are the few of the international registers where you can do the registrations of your protocol related to SLR and meta-analysis. Now, what about India ICMR? So, ICMR in 2017, if you see the document of 2017 of ICMR, they have mandated the submission of all type of research, including systematic review, to the ethics committee for review. So the committee which is registered with the ICMR or DHR. So that committee, if you are planning to do a SLR in India or meta-analysis, you have to submit your protocol to this committee, and that committee will give you the registration number. But later on in January 2024, the amendment has been done, and in that one, what they have mentioned that if you are performing a systematic review or meta-analysis and your protocol has followed the standard guidelines and procedures, including prospective registration in a standard database or registry, it does not require submission to the ethics committee for the clearance. It's clearly mentions. If you are registering your protocol with with the international registers or databases, so in that case there is no need to submit your protocol for the ICMR form ethics committee for the clearance. So there is no need for that, right? I hope it's clear. Okay. So important points with respect to SLR, the methodology for systematic review should be structured, transparent, reproducible, which will provide reliable finding to make a valid conclusion. And as already I told, researchers should be clear about the scope, eligibility criteria, searching for possible databases, issue of bias, analysis of included studies. All these things should be clear in the experts who are doing the SLR and meta-analysis. And it's always advisable, you have to involve a team for this, to do the SLR and meta-analysis, right? The why team is required, because you are doing the extraction of the literature, you are doing the analysis, so you need a different experts for the SLR and meta-analysis. If you are doing a meta-analysis, so you need a statistician as well. You can take the suggestions from that experts as well. If you are working on particular defined area, so you can involve a clinician as well. So clinician input will will make your protocol stronger. So you have to involve a team to do the SLR and meta-analysis. So steps in meta-analysis or SLR, if you are planning to do it, so what steps you have to follow? Step one is already told you, you have to be define your research questions into a PICO format. Now we are talking about PICO ST is also there, right? So PICO, P stands for the populations or the patients. You have to define which type of patients. Like if you are talking about diabetes mellitus, so which type of diabetes mellitus? Are you going to include all types of diabetes mellitus, or are you going to include only the type 1 or type 2 or gestational diabetes mellitus patients? So you have to define your populations or the patients. P stands for that. I is interventions. If you are looking for an interventional meta-analysis, so you have to define your interventions, which drug, which molecules, right? How many doses, duration of treatment. Then what is the comparator? So with which you are going to compare, whether you are going to compare with the control group or placebo group, whether you are going to compare with the standard group, define your comparator as well. Then O is your outcome. You have to define your outcome as well. Which parameters you are going to consider? Whether you are going to consider only the glucose level, whether you are going to consider HbA1c level, whether you are going to consider another parameters as well. So you have to define your outcome as well. And nowadays we are talking about PICO. Now there is a S and T as well. S stands for study design. which study design you are going to include, whether you are going to include only the RCT, whether you are going to include all types of clinical trial, whether you are going to include observational studies. So it's always advisable, if you are going to do a meta-analysis or SLR, try to include uniform size research design. Otherwise, it will create heterogeneity. You can't mix observational studies with the RCTs, right? It will create a lot of heterogeneities, and no one will believe on your data. Why you have mixed different research design? So your research design and RCT is a gold standard. So you have to do the, if there is a sufficient RCT, so you have to include only the RCTs. Then there is a T is also there. T is the time frame. So you have to define your time frame as well. That is a step one. Step two, you have to define your eligibility, inclusion and exclusion criteria, which studies you want to keep, which studies you want to throw out. Then in step three, before these steps, you have to be do the quality assessments of these studies. And after quality assessments, you have to do the extraction of data into the data extraction sheet. Then you have to analyze the data, and then you can perform subgroup or sensitivity analysis. So identification of studies, you have to search maximum possible databases. Sometimes students ask, sir, is PubMed is enough? No, PubMed is not enough. You have to go whatever the databases are available, which are accessible to you. So if like Embase is a subscription based. If you don't have a access, so you can collaborate with someone who have a Embase access, so that person can provide you the data, and your SLR methodology will become much more stronger. Then you can do the hand search, you can do the gray literature. There are various sites as well, references, emails. So all these possible databases you have to be searched, and you have to be make a search strategies. These search strategies you have to be put in the supplementary file, right? So all whatever you are doing, you have to put in the supplementary file. So all these things reviewer want to cross check, whether if your search strategy is not in a proper way, so the rest of the things no one will look for. If you are doing a mistake in the search strategy, so you have to be properly use the medical subject headings along with the boolean operators. So boolean operators you are combining with the mesh terms. So you can put the filter. For example, you want to search efficacy and safety of gapiron in the treatment of MDD. So how you can search? You can click on the advanced option in the PubMed. If I explain you about the PubMed, so you can use, if you are using or then you will find number of articles will be so many. The reason is because it will pick up all those articles where gapiron is mentioned, where MDD is mentioned. All those articles will be picked up, but your purpose is not to see those articles where gapiron and MDD are mentioned. You want to see what is the role of gapiron in MDD. So in that case, you have to use the and instead of or. So when you are using proper use of Boolean operator with the mesh terms, your literatures will be becomes more systematic. So this is the PubMed. Everyone, you might have seen this. I think due to lack of time, I am going to little bit faster. So in advanced options, you can see there is a query box. You can make this query box, and you can check the mesh terms as well, and then you can properly use. And here is also a filter left hand side. As I said, if you are planning to do the meta analysis of RCT only, so you can click on the RCT, so RCT will be reflected out. If you want to include clinical trial, you can put the range in the so time range as well. If you want to do the analysis of last 10 year only, so you can put the filter there as well. Then you can first screening you have to do based on the title, and on the based of titles you have to select articles which are relevant. And these screening only you can do when your objectives are defined in your mind. Otherwise you will be in confusions. And then you can select these options in the format abstract, and only the abstract of those article will be created which you have selected, which are important for your research. Then you have to do the eligibility of the studies. Then you can check the quality assessment. For quality assessment, there are so many critical appraisal, like there is a STAR, there is a MOOS, NOS, Newcastle, Ottawa, when you are doing for a case control studies. And you have to do all these analysis as per the Prisma. Prisma is your preferred reporting items for systematic review and meta-analysis. First published in 2009, and now it's 2020. We are following it. You just type in a Google Prisma, and you can get the here in the document checklist as well as the flow diagram. Flow diagram, sometime I have seen what students are doing. They are creating flow diagram by their self. There is no need to create the flow diagram by yourself. It's already available. You have to just fill the numbers. That's it. And Prisma checklist you have to put in the supplementary file, and you have to fill that checklist as well, right? So all these both things are required for proper, because by looking your SLR and meta-analysis manuscript, expert will get an idea whether you have done in a standard way or not. If you are missing to add the Prisma checklist, that means you have not done it in a proper way. If you are creating the flow diagram by yourself, that means you don't know flow diagram is already available. You have to just put the numbers. So this is a checklist where you can see that you have to fill it, and you have to mention where these particular things are there. In the introduction section, what should be there, what should be in the methodology, what should be in that one. And this is the flow diagram, as I said, where you have to put the number. At initial search, how many studies you are getting, then how many studies you have excluded based on title, based on abstract, and how many studies finally you have included for the qualitative synthesis, that is your SLR, and how many studies finally you have included for the quantitative analysis, that is your meta-analysis. Then you have to prepare your data extraction sheet. You can use the Excels. In that one you can add the author name, the type of studies, total number of subject. If you are looking for your death is the outcome, so your data extraction sheet will looks like that. Depending upon your research questions, your data extraction sheet column will be defined, right? And before this is a data extraction sheet, but before data extraction sheet, one more sheet you have to prepare, that will be the table 1 of your SLR and meta-analysis manuscript, that is contains the characteristics of the included studies. In that one you have to include how many males are there in that particular studies, how many females, what is the age group, all the parameters, all the informations you have to put, randomizations, blinding, everything. Then you have to do the analysis of the data. To do the analysis of data, there is a overall estimate measures you can calculate in terms of odd ratio, relative risk, or mean difference, or standard mean difference. So depending upon the type of data, you have to select. Now question is, when you will go with the odd ratio, relative risk, or mean difference, or SMD. The answer to this question is, if your data is continuous, then you have a measures MD and SMD. So you will go with the mean difference or standard mean difference. If your data is dichotomous, you can go with the odd ratio and relative risk. So now question, when you will go with the relative and odd ratio. Relative risk, when your outcome is death, we go with the generally with the odd ratios. Other than you can go with the relative risk. Mean difference and standard mean difference, when your outcome is measured in the same scale, then we are going with the mean difference. If it's measured in a different scales, same outcomes, then you will go with the standard mean difference. And variance you are calculating with the 95% confidence interval. And two plot which you have might have commonly seen in every meta-analysis, forest plot and funnel plot. So what is forest plot? So next part is analysis part. So if you see forest plot, फॉरेस्ट प्लॉट का मतलब क्या है इन सिंपलर वेज? फॉरेस्ट, ये आप देख सकते हो इन दिस पिक्चर, देयर इज ए फॉरेस्ट. फॉरेस्ट में क्या होता है? पेड़ होते हैं. अब इस पेड़ को आप क्लोजली देखो, एक पेड़ को. इन इफ यू आर सीइंग दिस ट्री क्लोजली, यू विल फाइंड दैट इसके सेंटर में एक मेजर जो स्टेम है, ये पर्टिकुलर सेंटर में, सेंटर से कुछ ब्रांचेज इस साइड है, कुछ ब्रांचेज इस साइड है, कुछ ब्रांचेज इस साइड है, कुछ ब्रांचेज इस साइड है. So agar if you see the forest plot closely, you will find that this is the central line, and among the central line, these are the lines. Some are this side, some are this side, right? So if you see if you want to analyze, if someone asks you to read the forest plot result, so you have to see only this diamond. Forget about rest of the things. If someone asks you, this is the forest plot, read this result, whether the results are significant or non-significant. Just look for this diamond. Diamond is providing you the overall estimate of all these studies. These are the individual study data. This is the study 1, 2, 3, 4, 5, 6. These are the individual studies data. These are the pooled estimate. And meta-analysis, you are pooling the studies, right? So this diamond is representing your pooled estimate. So you have to look for the diamond. If diamond, these are the total, these are the bold numbers are your diamond, and you can see that overall estimate in this case is calculated with the risk ratio. This is the MH is mental Hazel methods. This is the model. Model are of two types, fixed effect model and random effect model. We are going with the fixed effect model when variations among included study is less. We are going with the random effect model when variations among the included study is more. So then there is this is the 95% confidence interval. So this is the risk ratio of the first studies. 0.71, and in square bracket, this is the confidence interval. This 0.27 is the lower bound of the confidence interval. This 1.88 is upper bound of the confidence interval. And this line, this horizontal line, this line is representing your confidence intervals, right? And this is the relative risk ratios of this particular studies, this one, right? More the confidence intervals, wider the confidence interval, less will be the precisions, right? If variation is much more, less will be the precision. So what I am saying is you have to look for the diamond. If someone asks you to read the forest plot, and in diamond you can see that if diamond is touching this line, this is the null effect line. There is no effect line. This will be called no effect line. This vertical line, central line. So you can see closely in this picture, this diamond is touching the vertical line. So if your diamond is touching the vertical line or crossing the vertical line, so your conclusion is there is a change, but change is non-significant. That's it. So by looking the diamond, you can read the forest plot. You can say that, for example, in this case, the diamond is touching the vertical line. So your conclusion is the differences between the experimental and control group is non-significant. Got it? If your diamond is crossing this line, so if your diamond is not touching this line and it's fall this side or fall this side, so your conclusion is there is a significant differences. Got it? Between experimental and control group. So another things which you can read in the forest plot is this is the overall estimate 0.64 overall risk ratio, and in bracket this is the confidence interval. So confidence interval, you can see that lower bound is 0.36 and upper bound is 1.15. So lower bound is 0.36 falling this sides, and this is the vertical line which is at the 1. So it crosses the vertical line, it's 1.15. So your result is non-significant. If hypothetically I would say that if for example this is 0.64, this is 0.36 and here is 0.56 instead of 1.15, then what is your conclusion in that case? Your conclusion in that case is there is a significant differences between the experimental and control group. Got it? I hope it's clear. So now next one is you can see the heterogeneity. For heterogeneity there is a various measures. Quantitative measure is I square. There is a I square values. So you can see that 0%. So heterogeneity among the included study is 0. So that's why you can see that in this they are going with the fixed effect model rather than random effect model. If your heterogeneity is more, you have to go with the random effect model. Then you can see that this p-value, this total overall effect, there is a p-value, this demonstrating the overall statistical significance between all studies included in the meta-analysis. This is the heterogeneity. This is the overall estimate. This is the confidence interval. This width of the represent the confidence interval. This point estimate the true effect in the population in these studies. This is the line of no effects. So these are the the important point with respect to forest plot. Another plot which you will see in the meta-analysis is the funnel plot. सो फनल क्या होती है? फनल इसी तरह की दिखती है जिस तरह की आपको पिक्चर में दिख रही है. ऐसे ही कोई प्लॉट होगा फनल जिसको हम फनल प्लॉट बोलते हैं, राइट? सो यू कैन सी दैट फनल प्लॉट. So in funnel plot, you have to understand it's a qualitative assessment of the publication bias. Again, word qualitative. It's a qualitative assessment. By looking the funnel plot, you can conclude that whether there is a involvement of publication bias or not. That's it. You can't say whether there is a significant or non-significant and how much publication bias is there. You can't tell by funnel plot. By funnel plot, you can only tell there is a involvement of publication bias or not a involvement. So how you will read the funnel plot? If your funnel is symmetrical in shape, so your conclusion is there is a less involvement of publication bias. If your funnel is asymmetrical, you will conclude that there is a involvement of publication bias. Got it? And publication bias arise because only the studies with positive results are being published. Negative results studies are very less chances to get published. So due to that, there can be a publication bias. So how to read the funnel plot? You have to look the symmetry of the funnel plot. If it's a symmetrical, you will conclude that there is a less involvement of publication bias. If it's a asymmetrical, you have to involve there is a involvement of publication bias. Got it? So with the funnel plot, we are doing trim and fill methods. You can trim the studies that cause a funnel plot asymmetry, and then you can fill the imputed missing studies in the funnel plot based on the bias corrected overall estimate. Then weightage of studies, I have already shown you. How much time I have?
You can continue.
Okay. So then there is a weightage to the studies. Weightage is given to the individual studies depending upon the size of the trial. So you know that small sample size studies, we are providing the less weightage as compared to large sample size. And selection of model, as I told you already, it depends upon the variability between the studies. Fixed model is preferred if the variation between studies are small. Otherwise, we will go with the random effect model. And these are the assumptions of your fixed effect and random effect model. So why this is so? Because we can't exclude a small studies by giving it less weightage and too much weightage to a large studies. Then how selection of model influence the overall effect size? So you can see these two forest plot. Now you if I ask you to read this forest plot, so what is your conclusion? There is a aspirin and non-aspirin group. So what is your conclusion in by reading this forest plot? Your conclusion is there is a significant differences or non-significant? There is a significant differences. The reason is because your diamond is falling in one side, right? So there is a significant differences between the aspirin and non-aspirin group. Your diamond is not touching this line, vertical line, right? You can see the confidence intervals. So your confidence interval is 0.36 to 0.57, right? And this is your overall estimate measure, that is a 0.45. But you can see that heterogeneity, if you read the heterogeneity, this is 77%. So in this case, you can't go with the fixed effect models, you have to use the random effect model. So this is the same data which I have analyzed by using first fixed effect model, and then same data is analyzed by the random effect model. So you can see the differences in the overall effect size. In overall effect size, when I have used a fixed effect model, I am getting 0.45. And when I am using random effect model, that is 0.38. So actually it's a 0.38, not the 0.45. Because I have selected the wrong model for this data. So that's why I am getting little bit higher overall estimate measures, right? Heterogeneity is refer to the differences in the research outcome between the studies, and it is a something to be not something to afraid of. If you are getting a heterogeneity, don't be afraid of, because you are doing the analysis of the already published data. So there is no need to afraid of, but what you have to do is you have to try to find out the reason why I am getting that much heterogeneity. So there are a heterogeneity, as I said, is categorized into three category: clinical differences in the participants, intervention, outcomes, methodological differences, statistical differences. So these all are the contributors for the heterogeneities. So how to identify and measure heterogeneity? I already told you by the one parameter is I square. You can do the eyeball test. In eyeball test, you can see these two datas. So just see these two datas, you can get a little bit idea which one is more heterogeneous. So this, of course, this forest plot is more heterogeneous. So you can see this is this side, and here most of the studies are following this sides, right? This is the eyeball test. Another test is to check the heterogeneity, chi-square test. Chi-square test provide a p-values. You can see in the forest plot, you are getting the p-values to test the hypothesis. So low p-value indicate heterogeneity among the studies. I-square is the quantitative measure, because to measure the extent of heterogeneity rather than only stating if it is present or not, you eyeball test is just telling you, or chi-square, whether there is a heterogeneity or not, but how much it is, you can't get to know by the eyeball or chi-square test. To get to know about how much heterogeneity, you have to see the result of I-square test. So you can see that these are the total event heterogeneity: tau square, chi-square, degree of freedoms, I-square values, right? So how to deal with it? If you are getting a lot of heterogeneity, cross check for the mistake. Mostly high heterogeneity you can observe due to typographical error. For example, it's a 10.43, but by typographical error you are putting 104. So it could results in high heterogeneity. So you have to carefully check the data again, and then if heterogeneity is not too high, researchers should perform the, if still it's too high, then you have to perform the meta regression to explore the heterogeneity. This is a publication bias, as I already told. Funnel plot is the measures to get to know about qualitative assessment of publication bias. For the quantitative assessment of publication bias, you can apply the Bagger and Eager test, right? So this is the analysis. So bag test we are using when there is a small numbers, eager test for the large number. So these are the tests which conclude that whether there is a significant publication bias or not a significant publication bias. By applying these tests, you will get the p values, and based on that, you will conclude that whether the publication bias is significant or non-significant. And you can see by the funnel plot, you can only conclude that whether there is a publication bias or not a publication bias, but you can't say that whether the publication bias is significant or non-significant. So if you are getting a publication bias, so you have to search for the how to handle, you have to search for the unpublished results, and you should not limit it to your studies published in English language only. You have to be search in all the available search databases or engines where you can get more number of studies to reduce the publication bias. And you can do the subgroup analysis where you can compare male, female, age group, individual drug, formulation, strength, duration of treatment, and to check the effect of the outliers on the outcomes, you can perform the sensitivity analysis. So this is the last part. AI based tools will help you to speed up the process of this systematic review or meta analysis. This is the elicit by using you can analyze the research paper at superhuman speeds. So you because major time consuming part in SLR and meta analysis is screening of the literature, and screening of the literature you have to do very carefully. And as per the Prisma guidelines or standard guidelines, same literatures screening should be done by two independent researchers, same work. And then third team member will do the if there is a disagreement, so third team members will do the resolve these conflict of interest or disagreements among the two researchers. So at least two researchers should do the same work, then you can do it. So so these are the some of the tools by which you can analyze the papers, analyze the research studies at faster speeds. You can get, if you want to see how on this topic how many articles which are published in Q1 journal, Q2, Q3, Q4, you can put the filter. You want to put filter in the publications years, you can put the filters on the study type. You want to filter on the abstract. So all these tools you can explore. There is a AI for research is another tool. There is a Jenny is another tool, research assistance which helps. There is a lit suggest recommend similar studies based on your research interest using the machine learning. So this lit suggest also you can use it. Lit map is another one where you can put the name of your topic, and you can get in chronologically where when the first article is published on this particular topic, then second one. So faculty members can use this kind of tool to see whether the student have done the literature comprehensively or not, right? So you can use these lit map as well. Then next step is screening of the article using AI based tool. So there is a digital SR which many CROs and pharmaceutical companies are using. So of course it's a commercial one, but you can go through it. So you can add in your CV that you knows these tools. So company when there is a interviews, job interviews or something, so you will get edge over the other candidates. So these skills are required. You should know about the covidence. Covidence is also being used by various CROs and pharmaceutical companies for systematic reviews and meta-analysis. Rian also you can use it for the screening purposes. So you can create your login ID and passwords, and you can upload your studies in the Rian, and in the Rian you can do the blinding of the students as well. So you can upload your articles in the Rian. You can create login ID. So you can see that here you have to click start screening. So it will detect the duplicate as well. So same studies will be done by the two independent students. And then third one, you can see the progress of the work as well by doing the login, and you can see how many conflicts are there, and you can resolve that one as well. So you can see that here you have to be, by reading this, you have to be click on include. If you are confused whether it is relevant as per my objective or not, you can select the option maybe, or you can select the option exclude if it's not relevant. And if you want to exclude with the reason, you can give the reason as well. So all these you can do by these tool. There is a laser AI is another one which is helpful for the risk of bias. We have a various tools. This is the ROB2 tool by which you can do the risk of bias assessment. These are the forms where you can generate the figures as well. You can add various parameters values, and you can get the results, right? But AI systems, these are the software as I am talking about. R package, as I ask all of you to install R package in your laptop if you don't have, and use it. for various analysis, including meta-analysis. This is the Rebman. Rebman is now subscription based, so you can go with the R. This is the R project for statistical computing. So R is a language, an environment for statistical computing and graphics. So this is the link where you can get R, and you have to install R Studio as well, and where you can put the commands to run the R. So these are the simple steps by which you can install the R. Simple steps which you are doing for any other databases. So it looks like this. Then you can install R Studio. It looks like this, where you can put the commands R Studio. This is the R Studio setup. Then you can, how to use R, you can create the R projects, new directories, and these are the commands which you have to be put in the R. Whatever package you want to use, you can put the command install.packages, and in bracket you can add the package name. Then you have to be import the data, then you can read the CSV file, you can use the operators. So I am not going in detail. Later on someday we can conduct the workshop as well on that, so the you will get an idea how to use it. These are the important terms. And then grade approach. Grade is a systematic approach after conducting these SLR and meta-analysis. Now you are doing a systematic approach to rating the certainty of evidence in a systematic review and other evidence. So grade of recommendation, assessment, development and evaluation. So depending upon the grade, you have to grade your SLR and meta-analysis. ग्रेडिंग का मतलब क्या होता है? आप ग्रेड देते हो कि तुम्हारा ए ग्रेड है, ए प्लस प्लस है, या बी ग्रेड है, या सी ग्रेड है. सो लाइक दैट देर इज a grade analysis. So based on various parameters, we have to be do the grade analysis, and you can give the grading. And grading is based on randomizations, concealment of allocations, random sequence generations, risk bias. And grading is given like this: if you your systematic literature review and meta-analysis is getting grading high or 4, then there is a further research is not required. You can give the recommendations to the policy makers or to the regulatory authorities. If your grading is moderate, it may change because you need more data to do that. And if there is a low, that is very likely. If there is a very low, you are getting, that is the uncertain. That means more research is required. So to do the grade analysis, we have a Grade Pro. You just put in a Google Grade Pro. You can use the Grade Pro, where you can do the grade analysis in a proper way. So conclusion is, meta-analysis help to make better clinical decision, particularly in the complex issue. But again, SLR is must. Without SLR, you can't perform the meta-analysis, because to do the meta-analysis, you need the data. If you don't have a data, how you will do the analysis, right? It's a powerful tool, and it's always recommend to involve a group of experts to conduct this analysis in a proper way. And these are the recent publications which we have done by in the area of SLR and meta-analysis, and published in international journal. This is a book which I have authored, Meta-analysis in Clinical Research, Principle and Procedure, published with Springer Nature. So this is the authored book. I have written all the chapters in the sequence, starting from introduction, SLR, quality assessment, extraction analysis, model, heterogeneity, biases, and so on. So this contains, I think, 14 or 15 chapters, right, in a sequence, so that if anyone, and I also included the screenshot of Rabman, how to do the analysis of the data in a proper way. These all the organizations I would like to acknowledge. And again, I would like to thank Birla College for giving me the opportunities. It's always a pleasure to be part of any program which is being conducted at the Birla. Thank you so much. I hope I took a lot of time. Thank you so much. If any questions,
No,
I am
sir.
happy to answer.
Your session was so informative. I would like to request you, like you have explained about our pack, like you have explained about our package. I would like to please give some insights in the upcoming lecture about WASWare also, like how after extraction from our package, how we need to incorporate that, like we have to understand in WASWare.
Yes,
So
sure, definitely.
yes, so how,
Definitely, it will take means 2-3 hours practically, so I
yes,
can
yes, sir.
explain each commands how to use it.
Yes, sir. It
So,
was so informative session. I learned a lot. Even I was confused about these concepts. Actually, I'm using this meta-analysis
okay, great.
recent, so I
Okay,
learned a lot from this.
it's
So
my pleasure.
heartful congratulations, Dr. Anoop Kumar, sir, on delivering a highly informative and engaging lecture on meta-analysis. It was a successful session and we learned a lot from your expertise, your ability to break down the complex topic like Prisma, lit maps, and along with our package studios concept into in easily understandable bits was truly commendable. Thank you for sharing your knowledge and insights with us. As we conclude today's engaging online lecture series, I'd like to extend my heartfelt gratitude to everyone who made this event possible. A special thanks to our respected management committee for their continuous support and encouragement. We are grateful for your trust in us. To our esteemed director, Dr. Sailesh Sharma, we are thankful for guidance and leadership which, which inspire us to strive for excellence. To our HOD, Dr. Ajay Singh Kushwa, and our organizer, Dr. Rahul Kumar Sharma, your meticulous planning and hard work made this event a success. Thank you for your efforts. We are especially grateful to today's speaker, Dr. Anoop Kumar, for delivering an enlightening session on meta analysis, principle, and processes. Your expertise and clarity made the topic truly accessible and engaging. I would also like to thank the supporting staff and our audience for joining us today. Thank you, everyone, and we look forward to more such interaction sessions in the future. Thank you, sir.
Thank you so much, sir, for giving your wonderful time and wonderful knowledge, sir.
Thank you, sir. It's my pleasure. Thank you so much, sir. Thank you.
Thank you so much,
Thank you,
sir.
everyone.
Thank you so much, sir.
Thank you.